it's been about 6 months of us working together. And in that
Yes.
6 month period, I would say you guys are one of the high performing clinics that we've worked with. As I can see at the dashboard over here, I think the clinic has done around 80,000 ringgit. That's excluding the collections that are yet to come also at the same time, right? So I think these are decent numbers, but of course we want to strive above and beyond. And also, Miss Chia, please feel free to chime in as well and share your thoughts and your conversations and whatnot, right, when it comes to this. So I guess I would like to start off with just from hearing from you guys, right, in terms of like what would you say initially drew yourself, Dr. E, and Miss Chia in wanting to work with us in the first place?
Yeah, I mean, I was looking around because my previous marketing agency was not doing well.
Mhm.
Because it was very weird because my previous clinic used them and then I thought they were performing really well. And but when I use them, I start getting leads from Germany, from Czech, from Bangladesh,
Mm.
I don't know. I don't know. I mean, I understand the ads need time to learn, but that's a bit too much, isn't it?
Mm.
And then they're already spending, they're doing ad spend, and then I wanted to look for a way out. So I
Mm.
just looked, and then somehow and your ads pop up, and then I clicked into it, and then that's when I first spoke to you, Hargun, and
Mhm.
I thought it was pretty good, someone who filters the clients before they come in because traditionally how this works is that people pay for marketing, pay 5K, per month, and then they all become cold on text, and then
Mm.
there was no way to be sure, like, are we spending this money correctly?
Mm.
Will this go wasted? I mean, it was very reassuring that you guys at least gave the guarantee that at least we cover the cost. Whatever it is,
Mm.
your aim was to break even for us. So it's ultimately it's either we make money or it's zero.
Mm. Yeah. You don't
So
lose money, yeah, essentially.
yeah, at least I don't lose money from it. And I mean, I see the dedication that you guys do your work lah, because
Mm.
not just how you speak lah, because and also I see your team, how I think it makes a difference, like how all of your team members are, they are quite well
Mm.
spoken, they are quite diligent in their work. Yeah, I told Miss Shah even like I'm so envious of the team that you have built, like how I wish I have a team like that, But yeah. So I think that's what gave us confidence, not really. And then
Mhm.
basically your work attitude, how you
Mm.
guys remain professional a lot of times. I apologize if I've misspoken, if ever,
Likewise, yeah.
Yeah, I think that's what gave us confidence lah. And then the results
Mm.
show. I mean, first month itself, I mean, you have leads coming in, from locally, not from Germany and Czech, So yeah, that gave us confidence to continue working, and then it really helped our clinic sales lah. I mean, we can survive on, our. I mean, I think relatively quite strategic, our location. But it's just surviving, to actually do better. Yeah, actually, you guys, your side really provided a lot of, yeah,
Mm.
patience for us. Yeah.
I appreciate that, Dr. E. And I would also say, like, I think what you've experienced is something a lot of clinics have experienced, right? Like being burnt by a lot of marketing agencies. So there's always that level of skepticism that comes into the conversation, right? So when we discussed and we met, right, like, were you initially hesitant about the investment, and more so now after working with us, right? Like, how do you feel about it now? And you're looking back, how does that return that you received compared to the investment at the same time as well when it comes to that? And also more so overcoming that skepticism and being burnt in the past at the same time.
Mm. Yeah, obviously, it was really scary initially, because it's a 4 month cycle thing. So, being a clinic that is just starting, cash flow is everything. It's very, very tight. I had to
Mm.
really, go into my savings. Okay,
Mm.
let's just try it out.
Mm. Mm. Mm.
So,
Mm. Mm.
initially, we just, decided to really take the leap of faith.
Mm.
Just go ahead and I mean we were just betting on how we see you speak lah, I suppose. I mean, that was the only thing that we had, what you proposed, how you spoke. I think it gave us a lot of confidence lah. And then, just try it out lah. And then as we saw leads coming in, being a very, very new clinic, one day sometimes we hardly have 1K sales sometimes. But then seeing a couple of dentures, like just as simple as, five denture case, yeah, that was covering a lot of things for us already. Yeah, and then first month, and then we see increasing numbers second months. I mean, yeah, there were quieter months, but then eventually, we see the numbers rising, and then people start talking about us. Yeah, so that's when, oh, okay. And to a point now, maybe yeah, I mean, maybe we are slightly dependent, which is unhealthy. But then, yeah, because not only that, like as we have discussed before, those patients, when they've done their thing, they introduce people. Yeah, there's this word of mouth that also comes in. So yeah, even let's say for something as simple as scaling, for something as simple as extractions, slowly lah. I mean, because like for example, right now our appointments they are slowly getting to 6, 7 appointments per day averaging. So I think that's very good. I've compared to initially 2, 3. So 6, 7, continue. I mean, numbers are going up. I'm getting busier by the day. So that's why I miss your messages from time to time. So yeah, I think it's a good thing lah. But get
Sure.
drowned in messages, because there's a lot of things to take care of.
I
Yeah.
guess I guess we need to install an AI chatbot for your personal messages as well.
Probably. Yeah, but yeah, I mean, I think the results speak for themselves. The numbers speak for themselves. And it
Was there like a
really,
clear like ROI based on working with this? Because I think a lot of marketing agencies they focus on like vanity numbers, like we'll get you views, likes, shares,
yeah,
right? But when it
views,
came to
like
us, is more of
lead.
qualified appointments. What do you think about that?
I think it's really the numbers, yeah, you can really see the profit instead of, focusing on what you've put in or wasted. Yeah, other marketing agencies they just say I give you how many leads, how many likes, how many conversions. But what do conversions mean? Conversions into just scaling, conversions into yeah. But you guys always put out numbers, like what are the profits that we make? This is that, yeah. And then, yeah, obviously more than enough to cover, what I pay you guys. Oh, yeah, and the most important thing is that ultimately, when I switch the mindset, it's basically hiring my own digital marketer. Yeah, basically, that's basically hiring my own digital marketer. But then instead of one person, it's an entire team serving me. Yeah, so and then I can run ideas through you guys. I'm not dependent on one person's competence. Mm. So
And
yeah, I think
I
yeah,
like
that
that switch in mindset because speaking to a lot of clinics and even being having friends who are clinic owners, right, like very hesitant in investing into a marketer or even into a team, because as a dentist, right, sometimes you wear many different hats, right, and when you also start wearing the hat of doing the marketing and the content and all, it does get burnt out and wear out, right? So like by having this team in place, right, what would you say to clinics that are hesitant in having a team and then they complain that they're not growing fast, that switch in mindset, how has it directly affected you, and what would you say to those clinics that are a bit more on that other side?
I think times are different now. I mean, back then you really don't have to do marketing because it is a necessity, But looking on the awareness of Malaysian, it is still not enough. Malaysians don't have enough awareness to know to come to dental clinics voluntarily.
Mm.
Yeah, not yet, unfortunately. I still get plenty of patients who come, I mean, just because they have pain and not because they know
Mm.
I mean, they know they have something that needs fixing, but then they don't. So sometimes it's just that. So when they have pain, it comes, disappears, comes and goes. So I think ads are important where, they appear in front of patients, when yeah, it's because purchasing is always an impulse thing.
Mm,
It's when you connect to them emotionally, like
mm,
okay, this patient has this pain,
mm,
then your ad appears in front of them, and then that's when they, okay, this is the time that I need to go and fix my teeth.
mm,
Yeah, and um, instead of really wasting money in, redundant numbers, telling you leads and conversion and everything. I think actually spending to hire a marketer
mm,
it's a necessity these days. It's no longer optional, I
mm, mm,
think.
mm, mm, mm.
It's no longer optional. It's really something that you must spend. It's because that's why I tell my staff. Actually, I have three staff. Okay, both of you and one marketer. Yeah, yeah, yeah. I think they have to consider that as part of their operating cost,
Mm, mm,
because
mm,
otherwise you're basically just a sitting duck.
mm.
Nothing comes to you. Yeah,
Mm.
because not everybody can be in a really strategic location.
Yeah, correct. And I would say ads also only solves one part of the problem, which is just bringing in the awareness, right? And we also realize that, running ads is not enough because then your team and yourself are dealt to qualify the leads, which is why we introduced like the appointment setting team and also the AI, right? So just based on that, like introducing that, right, how would you describe the quality of the patients that have came in through our efforts compared to maybe previously or maybe other advertising efforts that you've done in the past?
I mean, they didn't need a lot of convincing. Yeah,
Okay.
they just needed a clear picture, because when I mentioned the price, they were like, okay, they just nod. When I
Mm.
mentioned this, they were like, okay, just nod. But some of them, I mean, obviously they would try to, ease in like, doctor,
I
no
know it
discount.
was true.
Yeah. But then, but they are generally very okay as long as they give them confidence. See, I just tell them, I don't know a better way to do than just, I mean, I charge you this
Mm,
price because I know I'm giving you the best of my abilities. And then they
mm,
are immediately convinced. So the difference is that they don't really need a lot of persuasion. They don't need a lot of convincing, because everything has been done and filtered out.
mm,
Yeah, and and a lot of things that when you guys discuss with us, there are certain bars or certain standards that we put out there. Like, I insist on consultation. We filter out a lot of bad, you know,
mm, mm. Could you
uh,
maybe go
I
a bit
mean,
deeper
poor
on
quality.
like how Nani like has assisted when it comes to pre-qualifying these appointments and also the communication of like sending the screenshot of the communication with the patients that makes it easier for you to know that we're setting the right expectations. Maybe you can touch on a little bit about that since you mentioned that has also alleviated a lot of headache, a lot of stress when it comes to dealing with patients.
Yes, because previously, we were very dependent on how our staff reply. And then not everybody is good at talking, not everybody is good at messaging. And then to force
Mm,
them to do it, it's quite difficult, because it doesn't come naturally to a lot
mm,
of people. And we just cannot afford to have our staff waste away leads that are coming in. Yeah. And what dealing with your side, what changed that a lot is that um I can see that you guys are really doing the best, putting in the best possible replies, really attending to their concerns, answering their questions properly. Meaning do what is needed. We give the best and of our capabilities, and we see whether the patients are up for it.
mm,
Yeah, instead of
mm,
us not doing good enough, and then we waste those leads.
mm, mm,
Yeah,
mm,
I mean, I can see, you guys implementing AI. I mean, the way Nani messages, even Miss Shah says, I think we need to teach our staff how Nani talks to the patient. Then we send screenshots to her. You see, this is how you should talk, blah, blah, things like that, even
mm,
before the AI. Yeah, so,
mm.
mm, um, yeah, because my previous clinic, they had to send their staff to closing classes, which
Okay.
did not really help, did not really help. They instead they became very pushy. uh
Mm,
yeah, and then yeah, we just wasted a lot of leads.
mm,
So right now the thing that I
mm,
mean, the AI is still new. It takes
mm,
time to learn, but then the moment you give it one instruction, and then immediately it knows what to say, I mean, what to say in
mm,
future. So
mm,
yeah. Some. I mean, I can just leave it up to you guys, lah. I don't have to worry too much most of the time. Yeah. I used to worry about how my staff speak to the patients. Sometimes I mean, I have to take over, but then I cannot do everything. Yeah.
Mm-hmm.
So I think that has really helped relieve a lot of burden from, you
Mm-hmm.
know, from managing the clinic as busy
Mm-hmm.
as it is. Yeah.
And especially in the initial stages, right? Like, especially the first couple of months working together, I'm sure there was a bit of that anxiousness and that skepticism, like, okay, you guys can guarantee all of this, but will it still work or not, right? Was there a
Mhm.
specific moment that it clicked, like, okay, everything is coming together and things are finally working, and we fulfilled our promise of what we mentioned and set out to do in the first place for EE?
Yeah. Yes. Definitely. Because initially, like beginning of the year, we were thinking, is it just denture season, or is it just a fluke,
Yeah, yeah.
But as we see, uh, basically what really gave us confidence was also the way Nani replies, and the way Nani replies also show how you guys manage the whole thing, and how to say, yes, and then initially we were just okay, just try it out, lor. I mean, but we see numbers keep coming. I'm like, oh, then that really gave us oh, I think this can actually be something long term, you
Mm,
know.
mm, 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 mm.
And then that's why we continue with the second cycle, And second
Mm,
cycle, for example, the last month, I think the last month actually had quite a lot of leads coming in,
mm, mm,
especially after
mm,
implementing the AI. Mm.
mm.
Yeah, basically the numbers are. It's ultimately it's still
It's
just
all
a
about, yeah, the numbers at the end of the day. That's true. Like,
yeah.
it's not about how many leads or views or likes. It's just about,
Like we were worried, but then after that, when our numbers
mm,
start increasing, I'm like, oh, okay,
mm, mm.
yeah.
And,
Mm.
and and are there any other areas in the clinic that are running smoother now that you don't have to worry about as compared to before working with us?
Uh, okay. Let's say at the reception counter, probably our staff has more time to do her admin work, instead of having to
Mm.
worry whether patients are replying, whether because
Yeah.
sometimes she replies late because she's busy. Yeah, so that helped, with her work, with her job scope. And
Mm,
then for me, it saves me a lot of time
mm,
having to, convince patient or, having to micromanage how was she replying. Um, yeah, and also save a lot of time convincing patients about the price point, especially. Yeah,
mm,
most of my consultation time spent right now is patients wanting to understand what choices do they have and then
mm,
what exactly do they need. That's all.
mm, mm,
I
mm,
don't
mm,
have to,
mm,
convince them about pricing. I don't
mm,
have to still filter out, whether they are fit. I mean, they are fit to, do this financially. Yeah, I
mm,
mean, all those work has been done by you guys. Yeah,
mm.
so I have
Understood.
more time on my hands.
Mm-hmm.
Yeah.
Amazing, amazing. Yeah. Jai, do you have anything that you want to share?
Pretty happy
Yeah,
with how our partnership has gone. I think Dr.eee has also been equally as amazing as a client.
very true.
Not
Yeah.
many clients are they're too much of a dentist more than a business owner. So that kind of affects our judgments also in terms of what should run and what should not run, right? And I can see that you are as equal is both in both business and in dentistry, and I think that's very good. A good mix, especially as a dentist and a clinic owner, right? So we also like to equally say thank you for being an amazing client for us, and we really hope to keep doing further and further. And that's something that me and Hargun, we always push the feeling that good necessarily isn't always enough. We try to always push the envelope to see, and we are not afraid to go to lengths that hasn't been discovered yet. So which is why we took a leap in the AI. Sometimes in the beginning, oh, we can just stick to how Nani is doing and go down that route, and it's working. Why should we change? Or we went down the AI route to even make it a better thing, right? So
Mm-hmm.
there are things that we're currently working on also that takes things to a different envelope, and we are excited to share with you in the next few months and see what we've done.